Do you know what hepatitis C is and how it spreads? Hepatitis C is a viral infection that primarily affects the liver, causing inflammation and potentially severe damage. This virus is primarily transmitted through blood-to-blood contact. Exposure can occur in various ways, such as sharing needles or unsafe practices during medical procedures. It's crucial to understand this virus and how it spreads. Understanding hepatitis C and its transmission is the first step in preventing it. Now let's delve into how hepatitis C is transmitted and the activities that increase the risk. Hepatitis C primarily makes its way from one person to another through blood-to-blood contact. This means that even a tiny amount of blood carrying the virus can cause infection if it enters another person's bloodstream. One of the most common ways this happens is through the sharing of needles, particularly among those who inject drugs. This high-risk activity can lead to direct blood-to-blood contact, providing an easy route for the hepatitis C virus to spread. Unsafe sex is another activity that can increase the risk of hepatitis C transmission. While sexual transmission is less common, it can occur, particularly when there are open sores or bleeding involved. It's also important to be aware of less obvious but equally risky activities. This includes sharing personal items like razors or toothbrushes that could potentially have traces of infected blood on them. Having a good understanding of these risk factors is critical. It's not just about knowing what to avoid. It's also about being able to make informed decisions about your health. This knowledge empowers you to take control and put into place effective measures to prevent hepatitis C transmission. Remember, it's not always the big, obvious things that put you at risk. Sometimes it's the small, everyday activities that we overlook. So stay informed, stay vigilant, and make smart choices. Knowing your risk factors can help you take preventive measures against hepatitis C. Safe sex and hygiene practices are crucial in reducing the risk of hepatitis C. Let's dive into a few essential practices that can help you stay healthy. First and foremost, the consistent and correct use of condoms cannot be overstated. Condoms act as a barrier, preventing blood, semen, and vaginal fluids from passing from one person to another during sex. This effectively reduces the chances of hepatitis C transmission. Next, limiting your number of sexual partners can significantly decrease your risk. The more partners you have, the more likely you are to come across someone who might be infected with hepatitis C. It's important to have open and honest conversations about sexual health with your partners, including discussions about any past or present infections. Moving on to hygiene practices, it's crucial to understand that hepatitis C can also be transmitted through personal items. Sharing items like toothbrushes and razors, which can have traces of blood, should be avoided. Remember, a small amount of blood is all it takes for the virus to spread. Lastly, maintaining overall personal hygiene, such as washing hands regularly and keeping your personal items clean, can contribute significantly to preventing the transmission of hepatitis C as well as other diseases. In conclusion, the importance of safe sex and hygiene practices in preventing hepatitis C transmission cannot be overstated. Remember, your hygiene practices can significantly reduce your risk of contracting hepatitis C. How safe is your healthcare facility? Let's discuss medical procedures and infection control. When it comes to medical procedures, it's paramount to ensure the tools and equipment used are sterile. This is a crucial step in preventing the transmission of hepatitis C. From a simple prick for a blood test to a more complex surgical procedure, all equipment should be properly disinfected and sterilized. But how can you ensure this? Inquire. Ask your healthcare provider about their sterilization processes. It's your health, and you have every right to know how they're safeguarding it. Now, let's delve a bit into non-medical procedures like tattoos, piercings, and acupuncture. These procedures also pose a risk for hepatitis C transmission if the equipment used is not properly sterilized. So how do you protect yourself? Choose reputable facilities. Look for places that have a good track record for hygiene and safety. Don't be swayed by low prices or fancy marketing. Remember, it's your health on the line. And don't forget to ask about infection control practices. Whether you're at a hospital for a procedure or at a tattoo parlor for some body art, it's essential to understand how they prevent infection. Do they use new needles for each customer? How do they clean their equipment? Being proactive about infection control can help protect you from hepatitis C. So ask those questions, choose your facilities wisely, and remember, safety first. Are you considering donating blood or organs? Let's talk about how hepatitis C affects this. Every donation undergoes a meticulous screening process to detect any signs of hepatitis C, ensuring safety for the recipient. This stringent procedure makes blood and organ donation a low-risk activity. So if you're thinking about making a life-saving contribution, don't let the fear of hepatitis C stop you. Donating blood and organs is safe, thanks to rigorous screening processes. Can vaccinations and health measures help prevent hepatitis C? Let's find out. Vaccinations for hepatitis A and B can be part of your preventive strategy, as they can stop co-infections that aggravate hepatitis C. General health measures are crucial too. Maintain a balanced diet, exercise regularly, avoid alcohol, and limit the use of medications that can harm the liver. These steps can help maintain liver health and reduce hepatitis C risk. Taking preventive health measures can help protect you from hepatitis C. Regular screening is a key prevention measure, especially if you are at a higher risk. It's crucial to get tested regularly for hepatitis C if you're in this category. Remember, understanding transmission, practicing safe sex and hygiene, prioritizing needle safety, ensuring infection control during medical procedures, and donating blood responsibly are all paramount. Get vaccinated and maintain your overall health. It's in your hands to prevent hepatitis C and protect your liver. Stay informed, get tested, and help spread the word about hepatitis C prevention.